Can you all please take a picture with f-stop 2.5 shutter speed of around 1 by 60 with the white balance in auto and ISO at 6000. How does that feel? Guys, my lecture today is not on big funda stuff on photography. Those are already big time photographs sitting here with big cameras in hand. Just leave. Just leave. You won't learn anything. Because my topic today is simple photography. Whatever gadget you have, whether it's your mobile, try to take better pictures. That's the purpose of today's lecture. So those people with big camera, many people have called me personally, doctor, I have a big camera with you. What should I do with it? Oh, great. So it has nothing to do with the size. It has everything to do with what you do. My topic today is on basic dental photography. I'm going to talk about very little topics on why photography. Why do you need photographs in a dental clinic in the first place? And what are the gadgets you should be using? And how to use it. I'm going to explain some of the gadgets which you can use in your clinic. See, my purpose or the purpose of online dentistry is to apply this tomorrow morning in your clinic. Patient walking into the clinic with a complaint of midline diastema. Sir, I have a gap here. Can you do something about it? What do you do? What do you do normally when somebody asks like that, sir, I have a gap in my front teeth? Tell me, come to the chat box. What do you normally do when you see that kind of a complaint from the chief complaint from the patient? What I've seen is people take a prescription pad. And I'm not talking about treatment plan here. This is practice management here. You can do veneers or you can do whatever you want. But what I've seen is doctors take it very lightly. They just take a piece of paper, prescription pad, and draw two teeth with a gap and then shade it. We are artists, no? Shade it nicely. We add material like this, and that is how your gap is going to be closed. The first question from the patient, sir, how much it will cost? Is there any guarantee when I eat something it will come off? No. If you want, you do then. If you want, you do then. It says, what rubbish is that you want it? He wants or he wants. That is practice management, guys. They should ask for it. Do not talk much if somebody comes with a midline diastema like that. Sir, I have a small gap here. Can I do something about it? Do not talk much. Put them in the dental chair. Take a picture and put like this in big screen. Guys, all I'm telling you to invest in your clinic tomorrow onwards, if possible, is a big screen. Not camera, a big screen. Something above 19-inch, preferably 32-inch, LED flat, curve, whatever. Let it be right behind you, guys. It's needed in your practice. That's an investment, believe me. Put that picture on the big screen. You know what's the first impression from the patient? God, doctor, this is this big. I didn't know that. According to them, everything is small. Now you have increased the seriousness. You should be increasing the seriousness. Put a close-up also. Make them more scared. Put a close-up also. The next question from the patient is never how much it will cost. Sir, I didn't know that, sir. Sir, can you do something now? Is it possible to do it now? I'm seeing this daily. Yeah? 23 years into private practice. I'm not joking here. Very openly they ask, can you do something now? Or when can you do it? That is practice management. That is the power of a photograph in practice management. Now that the ball is in your court, you can kick it out, do composite right then and there, or tell them, sorry, you'll have to come at least after 2 weeks. My next appointment for these kind of works is only after 2 weeks. They will wait for that 2 weeks. They should wait for that 2 weeks. If they wait for that 2 weeks, no complaint will ever come to your clinic. Doctor, you did this thing, no? It all came off in 6 months' time. You said it will last 2 years. No, their attitude will be entirely different. Doctor, that thing which you did, no, it was so nice, but something has happened, doctor. Can I just come and see you? See the attitude change? It's so important in private practice, attitude change. The way they put it across when there is a failure, how to approach when there is a failure. For that, it depends upon how you convinced. Whether you were in a hurry to do the treatment or patient was in a hurry to do the treatment. Big difference. That dialogue which I told you, keep it in your mind. You may not have heard it before, or you may not have noticed it before. What is the dialogue? Sir, in that case, sir, if you want, you do a root canal, sir. If you want, you do a root canal. It says, what the hell, yeah? I don't need to do a root canal in your mouth. If you want root canal, come to me. I will do root canal. That should be the attitude. If you want, you do root canal. That is attitude in private practice. This topic photography is practice management, guys. I have to talk about practice management. I can directly come into CAT and shutter speed and focal length and all that. It will be so boring. Now that the patient is in your custody, the ball is in your court. Now do whatever you want. Now you do these lines. Come to the chat box. Tell me, what are these lines called as? Those who are doing cosmetic dentistry, at least those who answered frenal attachment, composite and veneers and all that. Come to the chat box. Tell me, what does this line mean? No answers. Not interested in typing anything. Doctor, if you have something to say, just say and go. We are not interested in typing and all that. Proportion. It's actually the line of light reflection. The flash light is reflecting from that area. Visual perspective wise, when somebody sees a gap like that, why is a person seeing a gap like that? From your eyes, it goes to that teeth. That is the area. That is the perception you get back to your eyes. That is why you feel gap as well as slanting. It's a visual perspective, actually, where the line of light reflection is. So when you do composite filling in such a way that you do not change the line of light reflection. Keep it right there and try to make it more straighter. More straighter. It won't look that wide. That typical question, doctor, will it look wide? If that much gap, if I do, don't you think it will look wide? It won't look wide. Definitely it's wide. It's such a huge teeth. No doubt about it, but it won't look huge. If you look at these simple things in photography, line of light reflection, and do your composite work. No composite should be bulging out. Everything should be from that line going in so that the light gets reflected from that point. Show all this to the patient. Keep showing. They may not be interested. They already told you, doctor, when can you do it? Please tell me, doctor. Please show. You know why you have to keep showing all these things? You can charge whatever you want. There is nothing like a fixed charge for composite diastema closure. You can do whatever you want. Nobody's going to ask you charge. Believe me on that. They're not bothered because that's the way you have increased the seriousness. They want to do it immediately. Another patient with a complaint of teeth coming out, typical ortho, myo, whatever, teeth coming out, big overjet. Father and mother sitting next, kid sitting in the middle. Sir, my son's teeth coming forward. What do I do about it? Again, typical question. You look at like this and say, it's coming out. What do you mean it's coming out? Be professional when you talk to patients in a clinic. Put in the dental chair. Take picture. Take picture even like this. The same patient, mind you, a different angulation altogether. What is the normal overjet you have learned? And what is the overjet now? So, teeth coming out. Parents said the same thing, but you approached in a different way. You increased the need, the necessity. I can put it other way around. You scared them left and right. You scared them left and right, but it's for a good cause. Believe me, it's for a good cause, because the shopping The research should end in your clinic. The research should end in your clinic. They are researching. They want to ask you on face, doctor, how much is the cost of braces in your clinic? Instead of asking on face, they just said things. But one thing in their mindset, what is the cost of braces? Do you know the cost of braces in that clinic, this clinic? I came here to know the cost of braces. Some people might openly ask. Some people might even make a phone call, doctor, what is the cost of putting braces in your clinic? But this family was at least fair enough to come and ask you on face, show the kid on face, and then you talk. Why don't you put a scale inside? You have the metal scale you use for the endodontic purposes. Why don't you put the damn thing inside and take a picture like that? Tell me the overjet here. It would be 15 mm here. So we're talking about 13.5 mm as the overjet here. Guys, let me tell you one thing. If this parent is going to do more research on this kid and walk around to other clinics, this kid is going to go into a surgery pretty soon. Who is responsible? Because of our professional, unethical way of explaining things, a kid had to go for surgery. Research should end in your clinic. You know what I do normally is ask them one question. 13.5 mm, normally it's 2 to 4. Where were you all these years? Why didn't you show early? You should have showed him earlier. You should have showed him earlier. And immediately you can see the wife telling husband, last year, last vacation, the other doctor told the same thing. No, we should have done at that time. So what do you mean by that? 1 year research is going on with the kid in multiple clinics. Research should end in your place. Photograph plays a huge role. Photographs plays a huge role in convincing your treatment plan to the patient. Those who do not mind coming in video, please do that. Yeah, like me talking to myself. So irritating. So irritating. Me talking to myself. Like a selfie camera, Dr. Sahal, thank you so much. Yeah, at least somebody has to be here listening to me. Just keep the video on, but do not sleep off. Even if you sleep off, it's okay. Do not snore, okay? That's a disgrace to the speaker. Don't do that. So, we are in the topic of convincing the patients using photographs. So why do you need photographs in a dental clinic? I already covered the topic, practice management. In India, you talk about why you need photographs in a dental clinic. Answer is one, practice management. But anywhere else in the world, I would say, when you say why you need photographs in a dental clinic, the answers are different. It can be records management, insurance purposes, referral purposes. Things can change. Okay, I'm talking about India. I'm talking about Kerala. I would say. I don't know about other states. It's all the same. It's all the same in India. You need practice management. But otherwise, it's for records, documents. There are a lot of stuff there. Let's not go into that now. But my aim is practice management again. So, incorporating photography into your dental clinic. How to incorporate? Big question. God, I have a big camera in my hand, but I don't know how to. Then you have a mobile in your hand. You know how to use it. Which one to use? You do whatever you want. You use whatever you want. I don't care. Just take good pictures. That's all. The purpose of this lecture, next 30 minutes, is to help you take good pictures with whatever gadget you have. I just don't care which gadget you use. Guys, photography means photograph, good photograph, excellent photograph. Take photographs first, then talk about good photograph and excellent photograph. Why do you want to jump directly into an SLR with an excellent photograph? Take photographs. Start tomorrow. First case, whether it is scaling, do one half scaling. Take a picture lingual showing the differences. Doctor, you took off my enamel there. I had preserved it for last 10 years. You took it off. Show them what are you doing, guys. Show everything. So my point is photograph, good photograph and excellent photograph. You start off with photographs tomorrow. Please, guys, also listening to me tomorrow in practice, take a picture and send to me personally in WhatsApp or in your WhatsApp group as a start with your mobile. You don't need a digital SLR. Which are the most commonly taken views in a dental clinic? Extraoral view. Extraoral view means outside. Extraoral. Come on, you guys know how to take a great extraoral pictures. I've seen so many candidates in their status, excellent pictures, but when they post a patient picture, lousy picture. That is attitude, guys. It's not that you don't know how to take picture. That's attitude. Frontal picture. How to take a frontal picture. All you have to do is ask the patient to stand in front of a plain wall. Can't you do that? Ask the patient to stand in front of a plain wall and take a picture. Straight, eye to eye, straight. Not from here, not from here. This is not to show any new generation photography skills here. Direct, straight face. Clear background, simple, clear background, good proportioning, not too much here, not too much here, not too down here, showing all the way down to the legs. And you don't need all that here. Crop it nicely. After photo, after treatment, when you change the kid's personality altogether with orthodontics, you know what I do? I take an after photo of this kind. That will be like outside, background blur, the best photography possible. I even asked the kids, see, to next day, we are removing your braces. So please come well dressed. I have seen them coming in sari and big stuff. Yeah. I've seen even somebody coming with a professional photographer for that day. So after use the picture like this, but before always keep a picture in the jail kind of thing with a number and all that, the jail picture. Before, after put a nice one. And why don't you just print this out and give it your clinic name underneath as a souvenir to the patient, how this kid was looking before. That's a souvenir to your patient. And again, this is not part of my lecture. So frontal picture. Smiling, non-smiling, I don't care. What I'm looking at is how to take it. Then we quickly go into troubleshooting of this. Troubleshooting. This lecture is designed in such a way that I'm going to show you some badly taken pictures. And I'll let you know how to make it better. Okay? And thanks to all the doctors who agreed to show the picture here. It's all our own students who have posted in multiple groups in our groups as patient discussion. And I asked them specifically, is it okay I post this in one of my lecture? Because very sorry to say it's a badly taken. They said, no problem, please do it. If somebody learned from it, please do it and please teach me also. So thank you so much for the support shown to us for the last 12 years in our classes. Frontal view. Look at that. What a nice Venetian blind behind and the wooden cupboard work behind. Why can't you do that simple effort of asking the patient to stand in front of a plain wall? Do you need a digital SLR for that? You don't need. All you need is attitude. This one. This doctor never even bothered to ask the patient to get up off the dental chair. Took the supposed to be the so-called frontal picture with that assistant's hand and the jewelry and all that. Who cares about the jewelry of the assistant here? That's not the way to post a picture. Be professional, and you don't need a digital SLR for all this. That's what I'm trying to explain here. Profile picture, side view. Profile picture is slightly tougher than the frontal view. Slightly tougher than the frontal view. Because the biggest issue with the profile picture is something called a shadow. Can you see shadow? Shadow elimination is almost a 45 minutes topic, but I'm going to do that in 2 minutes time. How to eliminate shadow? Simple. Do not ask the patient to go stand so close to the wall. This is the wall, patient standing right here. No, come forward. Shadow won't be there. Or use a background which can absorb some light. Some cloth, best is a cloth. A curtain, a Venetian blind, which is like made of fabric, which can absorb light. Not that glaze tile and glass and all that, that will reflect light. That's all you have to do. Shadow will go off. And in case you still cannot do that, put it in Photoshop and play it around with Photoshop if you're good in computers and remove the shadow. Do not post a picture with shadow to the patient, to the journal. You look at any Indian journal now, you can see all sorts of pictures like this. But you look at an international journal, they will not have any shadows in it. So please do some little effort to get that shadow off. That's the only way you can get a good diagnosis, nasolabial angle, mentolabial sulcus, whatever you want to do, you need picture without profile. Troubleshooting again. Troubleshooting. Badly taken pictures. Great profile, but grandfather has no business here. I have no clue why is he there. It's a nice profile, well angulated, alatragal line parallel to the floor. Perfect profile orientation, but look at the background. This is another well taken, and this doctor agreed that he took it with a digital SLR. Well taken picture, beautiful picture, but look at the background. You just have to have a clean, plain background. Another one, great compressor, a nice compressor. What is the horsepower of that compressor? You want to guess? See, come to the point, guys. Don't show unnecessary things in your picture. Take some little effort. Ask the patient to get up off the dental chair, come to the wall and stand and take a picture. That's all I mean here. Intraoral view, I'm doing little inside, tougher now. Yeah, frontal was the easiest. Profile little tougher because of the shadow. Now intraoral. Comes to intraoral, there's something called retracted view and retracted mirror view. Retracted view means you retract with the cheek retractor. I hate these kind of headings in my lecture. I always try to put maximum pictures, but that's bare minimum. Retracted view means you retract with the cheek retractor. Retracted mirror view means you retract with the cheek retractor and use a mirror. Simple as that. So retracted view, use a cheek retractor. Just have to put in a cheek retractor and take a picture. That's all. It's not that difficult. And try to be as straight from the top as possible. You might have to keep the chair maximum down to be as straight as possible to get the most straight, perfect. Let's see some troubleshooting here also. Retraction with the finger and mouth mirror. And this doctor took it with the digital SLR. Now tell me, what's the advantage of having a digital SLR when you do not follow basics? That is again what I'm to stress in tonight's lecture. Whatever gadgets you have, you are good. I've seen many of your Insta profiles. You are good. You're good photographers. Just use that mindset in your dental clinic. That's all. You don't have to invest on big gadgets. So many messages I get before the lecture. Doctor, before I attend your lecture, I would like to know which camera should I invest on. They send me even links in Amazon. Sir, tell me which is the best camera. Before I attend the lecture, it seems. I said, do you have a mobile? Let's talk about camera later. Another one here. The doctor decided to use a cheek retractor. Thank God. That is fine. But the light is not evenly distributed. Too much of dark areas here. Why is that? Because the flash of a mobile phone many times might go in a different direction. So if you look at iPhone or any other phone, I would say when you try to focus onto the mouth, the flash might be going in a different angle altogether. So you may not get good light here. You know what? All you have to do is take your chair light, ask the assistant to focus it there, and take with your mobile phone. Beautiful pictures, but try to avoid that yellow halogen light of your chair. Okay, it should be white LED light. At least one chair in your dental clinic, invest on a white LED light, not the yellow light, not that yellow halogen stuff anymore. This is again same thing. Light not fully gone inside. But one more thing I want to comment about this. This doctor used a cheek retractor, which I think the doctor has been using right from the day the clinic was inaugurated. And that teak retractor is being used for all the composite works, all the bracketing works, everything. So it's dirty, it's scratched. Have a separate 100 rupee teak retractor, separate, clear, transparent, nice ones. 100 rupee exclusively for photography. All I've told you to invest today, tonight, at this point of time, is a 100 rupee cheek retractor. That's all. More investments are going to come, but I'm telling you, it's cheap. It's not that bad. I'm not that costly. Retracted mirror view. Now you have to have a mirror. So you have to retract and put a mirror here. See, guys, I'm going tougher and tougher. Tougher and tougher. So this is a mirror inside. Retractor there and mirror there. And take a picture of the upper arch and the lower arch. So you take a mirror inside, retract nicely, and take a picture. When you retract and take a picture, the picture will be like this. The biggest mistake you can do is showing this picture to the patient. Don't show this picture to the patient. First and foremost thing in mobile photography, when you take a lot of pictures, do not show to the patient like this immediately. That's not professional. First of all, you do 3 swipes. The fourth one can be some WhatsApp picture that got downloaded. You can be totally embarrassed. Don't do that. Just, first of all, if you're using mobile in your clinic, put an airplane mode and do it. Because while taking picture, you get a WhatsApp, you look at it, you smile for some time, and now then again keep taking picture. That's not professional. Don't be surprised if parents ask you one day on face, Doctor, why are you taking my daughter's picture with mobile camera? What answer can you give? So take consents. Take consents. Talk to them. Explain to them the importance of photograph, and then do. If they don't allow, that's not your patient. Take a picture like this and then crop it, turn it, rotate it, make it upper, make it lower separately, and then only show it to the patient. That's a lower. Upper, lower. Picture taken and cropped and shown to the patient. Troubleshooting. Wow, retracted mirror view has a lot of troubleshooting. It's not an easy picture. Let me tell you, it's not an easy picture. You need a lot of practice. No mirror. No mirror, no retractor. This is all you can get without a retractor, without a mirror. This is what you need. You need at least this kind of a fullness when you try to take it. This doctor used a mirror, but this mirror has a problem now. What is that? Can you see the scratch there? Scratched mirror. The biggest problem with these mirrors are scratches. The scratches will be highlighted. Another big problem is fogging. The moment you put it in, it fogs. What do you do to avoid fogging? You can do many things. You can like buy an anti-fog mirror, which is like 4,000 rupees. What I do in my clinic for my mirrors is the 300 rupee, 200, 300 rupee Amazon stuff, which is like steel ones, not mirror, steel. It scratches, but it scratches only if you're very careless with it. You like take a picture, just throw it like that to the granite table and all that. Just let the staff take it, pouch it, autoclave it, put it nicely. Nothing's going to happen. Even if it scratches, just buy a new one. It's under 200 rupees I'm talking about. So it's attitude. Take a Amazon searching, you can get all these mirrors, which are very cheap, 200, 300 rupees. That's it. You can get mirrors. But professionally speaking, yeah, you are supposed to have a good anti-fog, anti-scratch, a lot of stuff we can talk about. But my purpose of the lecture is not that. Another thing here. This patient, celebrity, you are trying to explain to about enameloplasty. You're trying to explain about mild enamel contouring and all that. Your plan in mind is a veneer, canine to canine veneer for beautiful smile creation. You explain everything. After complete explanation, patient asks you, Doctor, is this white spot cancer or something? All my explanation got wasted. Guys, their mind is not in what you are seeing. Their mind was in those white spots here and there. So come to the point. Talk about the point. The first and foremost thing is management sale closure is eye to eye direct contact with the client and talking to the point. Now you are talking about EMI because you're talking about veneers because you have your EMIs. My next 2 months EMIs will be covered if she allows for that canine to canine veneer and all that. That's what's in your mind. Patient will be having a different mind altogether. All you have to do is to take a black chart paper, or something called as a contraster. Black stuff you can buy as a contraster, around 500 rupees in Amazon, you can get it, and put it inside like this and take a picture. Don't you think it's definitely better than the other one? Don't you think you are explaining to the point now? And what is the investment? Black chart paper. Those of kids here will understand. There'll be black chart paper at home. Just cut it into this shape and use it. This particular picture is taken with a black chart paper. But I have a contraster, which is around 500 rupees. That's all. I'm not costly. I'm telling you again. All simple stuff. It's attitude. It's attitude. Now, general photography is also part of today. A little bit of general photography is also part of today because the flyer was showing some pictures, which is my garden pictures and all that. So many people ask, why can't you talk a little bit about general photography? So instead of explaining about general photography, I thought I'll just put a question here. It's a quiz question. No prizes, okay? No prizes. But just see whether you can answer. When you see a photo of a cricketer tying shoelace in the middle of the field, cricketer tying a shoelace in the middle of the field. I'm sure you have seen that in many cricket scenarios, such a lace being tied and all that when the game is happening there right in the middle of the pitch. What do you think will be the lens they are using is the question here. What is a millimeter, the mm of the lens? Mm or the focal length. Mm is a focal length that determines how closer you can get a picture. So this is a picture taken with 18 mm lens. So you're standing in one place, you put an 18 mm lens and take a picture. This is what you get. Then same position you stand, but use a 24 mm lens, see what happens. Same position you stand, put a 35 mm lens, see what happens. 50 mm, 70 mm, 100 mm. Look at that, 200 mm. Compare that 300 mm with that 18 mm. This is focal length. This is the mm. Every phone will show that. Even iPhone will show all the mm's of your lens. That shows how close you can go. That's an optical property of the camera, of the lens. Haven't you seen these like long, big ones, people sitting in the boundary line? That's these lenses we're talking about, 800,600 mm lenses. You can spot that bale that is falling down from the wicket. Coming to close-up photography, little tougher again. I'm going tougher and tougher. Close-up photography. Here you have a patient with a complaint of a cavity on premolar. So you look at it and say, oh yeah, there's a cavity. I'll fill it for you. One tooth filling, 2,000 rupees, whatever. I don't want to talk about the cost here, but just for example, one tooth filling, 2,000 rupees. And you ask the patient to sit and you start doing, patient agreed for one tooth, 2,000 rupees. You start doing it. But when you clean it up, what do you see there? If you look carefully, there is a cavity on the mesial of 6 also. Now what to do? I'm stuck. Already somehow convinced him for one teeth, 2,000 rupees. Suddenly I tell him 2 teeth, 4,000 rupees. He might either hit me, he won't trust me, he won't like what I say. These are all our attitudes, our problems here. Explain what is showing. You are not the reason for that one tooth becoming into 2. Are you the reason? When an oncologist says stage 1, stage 2, stage 3, stage 4, nobody has a problem. When you say it has gone from one teeth to second teeth, there's a problem. He's trying to make money, it seems. Is how you put it across in your practice. Take picture, show them, explain to them that why did you wait all this time? Because you never came earlier, it spread into the next teeth. I know dentists who will not talk much and fill that 6 and then the 5 and collect money only for the 5. At least that 5 money, 2,000 rupees is confirmed. Now I don't want to talk too much and complicated. I'll do that 6 free of cost. And I know dentists who don't even talk about 6, do 6, only do 5. That's not ethical dentistry, guys. That's not ethical dentistry. Hiding that, not even telling them, not even doing it, doing only 5 and charging only for 5. That's not ethical dentistry. You know what? Real estate or try selling PPE kit to multiple hospitals in your place, much lucrative than dentistry. If you're doing dentistry, do ethical dentistry, do proper dentistry. That's not nice. Hiding stuff from the patient, that's not ethical. Explain everything openly. If you don't explain, who will explain? It's dentist's obligation to the society to explain everything properly. So be open, be honest. Now, this particular patient, I cleaned up completely. You'd never know that mesial of 6 can be a bigger one than the original cavity you started with many times. Practitioners here will understand what I'm talking about. Now, you have to fill 6 first, then 5. Fill individually 6 and 5. Show pictures. Give it off to their WhatsApp. Let them go home and just see. Let them confirm that he or she was not cheated. This doctor was so specific in what he or she said. Let them see it. Let them keep seeing why the 2,000 became 4,000. Let them see. No issue. I'm just giving examples. That it can be in any scenario, but importance of close-up photography comes there. Another picture here, patient with excruciating pain coming. Morning, they'll be standing in front of your clinic. Whole night, I didn't sleep. Now you look at the mouth, you see it. You see, what do you see there? Can somebody come to the chat box and tell me what do you see there? Why is this patient having severe pain? Which tooth is causing severe pain? Bruxism, perfect. But bruxism cannot cause that overnight severe pain, right? No 6. Yeah, it's a Rishabh Kapoor. Perfect. Why can't these people come in video? Rishabh Kapoor, come in video. Let me see you. That's a perfect answering there. No, not interested. Come in video. Rishabh Kapoor, thank you so much, sir. Thank you so much. Hey, come in video. See, we could have taken Zoom, the meeting option. Why did we take Zoom webinar option? It was much cheaper. The meeting option was much cheaper. We are spending thousands and thousands per month on Zoom webinar option just because we can have 1,000 people in videos together. That's the most costliest plan you can get in Zoom. But people are hiding. I don't know. Maybe it's too late. They don't want to see the faculty. They don't want the faculty to see me sleeping, dozing off, and all that. You know. Nothing like that. These are all simple general dentistry topics here. I know you won't sleep here. You got to be that sleep deprived to sleep for a lecture of such a common topic. I'm not talking big articles and stuff here. Okay, so 5, through and through fracture of 5. That's the reason for pain. Now, how are you going to explain this patient? Treatment plan is not what I'm asking. Okay, what is the treatment plan? Yeah, come on, Rishabh, tell me, what is the treatment plan for this 5 then? You said 5 is fractured. Yes, you're perfectly spot on your diagnosis. So what is your treatment plan now on that 5? Through and through fracture of the 5. What is your treatment plan? X-ray and decide. Extraction, X-ray, banding and restoration. Makes sense. Restoration means what, sir? I'm assuming you're talking about root canals, right? This is like through and through vertical fracture. I don't know any restorations can do anything. You have to immediately band it, do a root canal. Moment you remove the band, put a crown. And be a good believer. Pray to God Almighty that it stays there. That's all I can say. You can do it, no issues. You can do it. But the point here is how to explain this to the patient. Other option is what? Extraction and implant. But look from the patient's point of view. You're now talking about like 10,000, 15,000, 20,000. A root canal and a cap in my clinic is around 15,000 rupees. So we are talking about 15,000 rupees and an implant around 50,000 rupees or 70,000 rupees. Patient knows only one thing. Sir, I had a peanut yesterday, sir. I will never eat peanut in my life, sir. You're talking about 50,000 rupees? To make them understand the seriousness of the scenario, you need photos. And for these kind of close-up pictures, let me tell you, somebody asked the question already. Intraoral camera is the best. So you don't have to still invest on that digital SLR. You can invest on an intraoral camera, which is like what, 3,000, 4,000, 5,000 rupees. You get beautiful intraoral cameras. Let me tell you, intraoral camera should be part of your dental chair. Like the aerator in there, next in the slot should be an intraoral camera in your clinic. Mouth mirror and probe is for you to see what is happening inside the patient's mouth. Why do you want to see what is happening inside the patient's mouth? From that words of the patient, only you know what you're going to see. Sir, I didn't sleep yesterday night, sir. It was so painful. Then one question, you had any problem with that teeth? Yeah, last 6 months food was going in, I was picking it, this, that, perfect. Now you know what you're going to see, right? You are so clear what you're going to see. You've seen that for years. Just have to open the mouth. It's a huge cavity. The patient has been walking around for the last 1 year with that cavity and says, had no pain, sir, I didn't come. So you know the diagnosis without even looking at the mouth. But will patient understand what you're talking about? That's why if mouth mirror and probe is for you to see what is happening inside the mouth, an intraoral camera is for the patient to see what's happening inside the mouth. And if the patient do not see what's happening inside the mouth, your sale is not going to get closed. Invest on intraoral camera, 3,000, 5,000 rupees, next conference or wherever you go, buy it, just buy it. It is worth it, let me tell you. Every case, before even looking at mouth mirror and probe, many times I just do this and tell patient to come. Let's see here. Big screen there. Let's see what all is happening. Because you already saw it, you know what is happening. The best part about that is they might be better convinced about other teeth also. Doctor, in that case, from what I understood, will this teeth also become the same thing soon? What about this teeth will have the same problem soon? Yes. Now come to bruxism. Now talk about night grinding. Now talk about tensions, stress. Now talk about night guards. So more money coming in. You didn't ask. They asked for it. They asked for that. That is practice management. Rule of third in photography. One general photography question again. Rule of third in photography. What do you mean by rule of third in photography? Rule of third is nothing but every camera you take, every photograph you take, there's something called as a grid you see there. That's a composition. Every picture will be a grid. Many cameras you might have seen before clicking, you can see the grid there. Have you ever wondered why they have those lines kept there? That's called rule of third photography. Wherein this is general photography, okay? This is not dental. General photography, wherein a picture, so a lighthouse, there's a lighthouse. That lighthouse is kept right on the middle of the frame, okay? Look carefully, guys. A better picture is always like the subject kept little to one of the thirds, not in the middle. That's called rule of third in photography. With that knowledge, now you take up any magazine, any big fashion magazines, or anything you take, you can see all photographs having a subject, a flower or whatever, will be little towards one edge of this. Look at this. This picture will not have the life if that dog was right in the middle. The life, the picture becomes meaningful and life comes to the picture if you follow that rule of third. another picture with rule of third, another picture with rule of third. That right in the middle won't give that life. It should have a little bit of, so that's about rule. That's a general photography again. Surgical photo. Surgical photo, you can take pictures of surgery, any surgery you want, but you need little more better gadgets. Intraoral camera may not do. You might require a digital SLR for good surgical pictures. But what I want to tell you here is when you're taking surgical pictures, ask the surgeon, tell the surgeon that you are going to take pictures. While surgeon is doing surgery, there you can't do like wedding photography there. Yeah. Tell them next picture I need, next stage I need a picture. Give a new gloves to the surgeon. Now you check an Indian journal of oral surgery and all that, you can see all blood here and there. But and then compare with the international journal. So neat, perfectly taken. That is the difference I'm talking about. All that you need for that again is that attitude. Asking the surgeon, see, I'm documenting this particular procedure. So every stage, please clean up completely, put a new pair of gloves, retract nicely for me. Let me take a picture. That's what I mean. It's not wedding photography going on here. Photograph an X-ray. Oh, come on. I think I should take off this slide from my lecture because it's all digital these days. But still, I can see some X-ray centers giving films like that. If it's a film like that, all you have to do is put it in a view box. I don't have a view box. Only my orthopedic surgeon I've seen a view box. I have never seen a view box. Amazon again, 1,300 rupees. You get beautiful LED view box. Invest on it and keep the X-ray on the view box. Switch off all other lights in the room. Switch off all other lights. Let it be a dark room and click a picture. You get this is all digitized by me. This picture is digitized by me. This is not a digital X-ray here. Even OPGs, if it's not digital, you can take a picture of it and immediately transfer it to your surgeon or TMJ specialist or whatever. There's an IOPA being digitized. Even before I invested on my RVG, when maybe 15 years before. Before that also, 15 years before, when I was using the conventional film, after that washing and all that, which takes like what 1 minute by the staff, then dry it and give the film. Never show the patient with that forceps and all that like this. Another 30, 40 seconds I spent, put that film in the view box. The chair has a view box, yeah. Put the film there, take a picture, crop it, bring to the computer, show them in style. Before even I had RVG. So now that with the RVG, things have changed completely. So I don't think these slides are anymore relevant. Photograph a cast, I'm almost done. Photograph a cast. Why do you need a cast photograph? All that recording purposes, all that patient orthodontic or whatever recording purposes. But if you want to take a picture of a cast, my suggestion is that always use a white POP with a black background. You get nice contrast pictures, not that yellow POP, with that yellow stone and green stone and all that for photography purposes. Try to use a white one with a black background, gives good pictures. What's the full form of DSLR? These questions are meant for nothing other than making sure nobody's sleeping here. Full form of DSLR. Anybody wants to guess? Interestingly, you better guess because for the certificate of participation of this program tonight, there will be a quiz and this question will be there. This is for those people who are listening to me. For those people who come at around 10:30 exclusively to collect the certificate, that's a different story altogether. But full form DSLR, you can easily Google it, not a big deal. Digital single lens reflex camera. That's ultimate in photography, no doubt about it. Ultimate in photography. But many of the things I showed you here, you can take care with your mobiles. Maximum an intraoral camera. But told you photograph, good photograph, and excellent photograph. That's when you need a digital SLR. Next 2 to 3 slides is exclusively for the digital SLR people. For those people who told me today that, sir, I have a big camera, sir, please, in the lecture, you have to explain how to use my big camera. I didn't want to ask him, show me the size. That might look a little rude. So this is the big camera people here, DSLR. You buy a body Canon 80D or EOS, any camera, you buy a body. And when you buy a body, you get around 1855 lens free with it. That 1855 lens, which you get free with it, is worthless in dental photography. Your mobiles can take much better picture. If you want to use your digital SLR inside your clinic, you've got to invest on something called as 100 mm macro lens. 100 mm macro lens, you have to invest, not just a digital SLR. That lens you get free is worthless. You have to have a 100 mm macro lens. A nice DSLR body, which can be like what an offer you can get for like 16, 20, 25,000 rupees now, and a 100 mm macro lens can be around 30,000 rupees. If that much you can spend, you can get excellent pictures in your clinic. But again, once you start doing it, you have to think on investing on ring flash or a twin flash, which will completely eliminate shadows in your photography. You have a ring flash or a twin flash. Again, cost going up and up. It is my promise, online industry promise. We will not talk about costly stuff. But we are planning to come out with an exclusive separate session on intraoral camera and digital SLR photography. And this slide again is for those people who have the big camera but have no idea how to use it. All you have to do tomorrow, give a try. Put it in manual mode. Never put it in green. This is one area which I say never go green. Photography, dental photography, digital SLR, never go green. Put it in red. My clinic name is Kerala Dental Clinic, go green. But here, never go green. It has to be red, manual mode. Put it in manual mode and then put your f-stop 16 as the aperture. Aperture determines the amount of light that goes in and out. And then the exposure, which is the shutter speed, which can be 1/200. Click this picture if you have an SLR. This slide, keep it ready tomorrow. If you have a patient, put in this setting, take a picture, and then show me tomorrow. You will be so happy to see beautiful pictures coming out. But it will be 100 mm macro lens, not the conventional 1855 lens for you. So to conclude, what all did I cover? Talked about importance of photography in dental clinic. Talked about most commonly taken pictures in dental clinic. Gadgets used in dental photography. Talked a little about close-up photography. Some tips for SLR users. What did I miss? What I missed today? I know I've missed a lot of stuff. Transferring the picture to the computer needs some skill. But with all the latest Wi-Fi transferring and all that, it's not a big deal anymore. You do much better transferings after that wedding you go or the trip you do. But in dental clinics, somehow people become so irresponsible, I would say, or act as if they don't know anything. But they do beautiful pictures and croppings and all that in the Insta profiles. Editing, how to do editing. You have all sorts of apps in your mobile to do editing, but dental photograph somehow comes out lousy. I don't know why. Backing up and retrieving, very, very important topic. Backing up and retrieving happened to me personally. My whole laptop bag was inside my car. Morning when I got up, there was an intrusion. The car windshield broken and my laptop. I had the complete backup in a hard disk, but that hard disk was also in the front pouch of that laptop. Now what? Now I am taking these lectures just because I had cloud backup. So how to backup in cloud, how to retrieve it at the right time. Very important to learn the editing, backing up, and the retrieving of pictures about cloud backing up. And then the most important thing which I missed is hands-on. Yes. Without hands-on, I would say dentistry, the photography is almost like learning swimming online. That's not going to work. That's just not going to work. You got to have hands-on. We have hands-on sessions. We have one full day program on photography and practice management. But with this COVID, we have suspended all that for the time being. Thank you very much.